Welcome to this special presentation on the moral challenges of science during the COVID-19 pandemic. Today, we're diving into the ethical dilemmas that have shaped our response to this global crisis. When the pandemic struck, scientists worldwide raced against time to understand the virus, develop treatments, and create vaccines, but this urgency brought about significant ethical questions. Take vaccine development, for instance. Traditionally, vaccines undergo years of testing before approval. With COVID-19, we had to accelerate this process. The question was, how do we balance speed with safety? We needed to ensure vaccines were safe and effective without compromising on rigorous scientific standards. In clinical trials, we faced another moral challenge. Who gets access to experimental treatments? During the pandemic, certain groups were prioritized for trials: healthcare workers, the elderly, and those with underlying conditions. While this was necessary, it raised concerns about equity and fairness. And what about global access to vaccines? Wealthy nations secured doses quickly, leaving poorer countries struggling. This disparity highlighted the moral duty to ensure that life-saving treatments are available to all, not just the privileged few. Science doesn't exist in a vacuum. Every decision that has been made has ethical implications. During COVID-19, we were constantly walking a tightrope, balancing scientific innovation with our moral responsibilities. Another crucial element was public trust. In an age where misinformation spreads like wildfire, maintaining public trust became paramount. Scientists and public health officials needed to communicate transparently and honestly. We had to be open about uncertainties, setbacks, and the evolving nature of our understanding. This pandemic saw an unprecedented level of misinformation, from false cures to conspiracy theories. Combating this required a concerted effort to provide accurate, timely information and to engage with the public empathetically. We had to acknowledge fears and concerns while firmly dispelling myths. Ethical communication involves not only presenting facts, but also understanding the societal context. We needed to ensure that our messages were accessible and respectful of different cultures and communities. This was particularly important when addressing vaccine hesitancy and the spread of false information. Privacy and data usage also posed ethical challenges. Contact tracing and health monitoring required collecting vast amounts of personal data. Balancing the benefits of these tools with the right to privacy was a delicate task. We had to implement robust safeguards to protect individual rights while maximizing public health benefits. Moreover, the pandemic underscored the importance of international collaboration. Sharing data, research, and resources across borders was crucial. This raised questions about intellectual property rights and the moral obligation to prioritize human lives over profits. The global scientific community had to navigate these waters carefully to foster a spirit of cooperation and mutual aid. The COVID-19 pandemic has been a profound lesson in the intersection of science and ethics. It has reminded us that scientific progress must always be guided by our commitment to humanity. We must ensure that our pursuit of knowledge and innovation remains anchored in our shared moral values. As we move forward, let's carry these lessons with us. Let's continue to prioritize ethical considerations in our scientific endeavors. Together, we can build a future where science serves the greater good, and our moral compass guides us through even the most challenging times.